guys. I'm Melissa Miller. I'm the Allied Health Coordinator here at Schoonover College, part of our COVID task force team. We have Dr. Renick here. He's with Graham Health Systems, and he's going to do our college theme presentation today. So I'll let him take it over from here.
Thank you. Well, thanks for having me. Fortunately, I've had to talk about this a lot here recently. So I'm Patrick Renick. I'm a family doc here at Graham. I've been here since 2008. I practice both at the clinic and hospitals. I've seen COVID a lot of places, talked about vaccines a lot of places. So that's what we're going to talk about. This is pretty informal and short. Questions are welcome. That's why we're here. Not a lot of slides, but we'll go through kind of basics about COVID vaccination. So first, kind of the mechanism, proposed mechanisms for vaccines for COVID. The main thing we're targeting is the spike protein. The spike protein is key for the virus to infect a person. So that's the main target. So they propose just giving the spike protein and having your body respond to that. We don't have a current vaccine like that. They propose giving it through a virus, a benign virus with coding for the spike protein. To give that, and then your body takes up that material, expresses the spike protein on your cells, and then you fight off those spike proteins, and then you have immunity. So that method right there is the Johnson & Johnson vaccine. That's how it works. The Pfizer and Moderna vaccines, they're actually what we call messenger RNA. So this is genetic material. It's packaged like in a, how do I say, lipophilic package. So it goes into the cell. And then your body takes that up. It takes that messenger RNA, turns it into the spike protein where it's expressed on the cell, and then you get immunity from that. So that's the Pfizer and Moderna vaccines. So let's talk about side effects. This is what most people talk about. So you can have some mild side effects here, fevers, chills, all this stuff. You can have severe, like look at all these things, pneumonia, death. Oh wait, I got mixed up my slides. Yeah, this is what can happen if you're I mixed that up. That's not bad. But this is why we're here, because we want to avoid this stuff. Most of you are young and healthy and have normal immune systems. So if you got COVID, you probably would have a mild infection or maybe no symptoms at all. Some of you could get severe infections, but most of you would not. But you come in contact with your professors, with your parents, with your grandparents, with older folks, people with other conditions, and they get sick with this. So that's why this vaccination is so important. So here are the real side effects. So the most common ones are drowsiness, chills. I had the Moderna vaccine, and I had chills with it for about 12 hours, but went away. Pain at the injection site, headache, muscle pain, nausea, fever, fatigue. I had missed baseball games. These are my two oldest. They had the Pfizer vaccine in June, I think. And they did fine with the first one, had a little bit of achiness and not feeling well the next day after their second one. And so my son missed his baseball game. All right, so there's something called the Vaccine Adverse Event Reporting System. So this has gotten a lot of news here recently. No one talked about it until COVID, basically. And so basically what it is a huge system where if anybody has any reaction or potential reaction to a vaccine, then they report it to this. It doesn't necessarily have to be caused by it. Like the big thing is like if someone dies around the time they get a COVID vaccine, they report it to this system. So a lot of people took this data and they're like, 6,000 people, 7,000 people died from the COVID vaccination. 6,000 or 7,000 people died around the time they got a COVID vaccine, but did it actually cause it? Probably not. They go back and study all the cases, and there hasn't been a great link. It's just kind of coincidental. And so I put the baseline death rate, so a certain number of people are gonna die regardless of whether they get the vaccine or not. So very low likelihood of dying after getting the vaccine. Anaphylaxis, that's like a severe allergic reaction. It's very rare after COVID vaccine. The one thing we know is if you have a collagen allergy, you should not get the vaccine. Most people are not allergic to collagen or don't know if they're allergic to collagen, and that's exceedingly rare anyway. There has been some reports of blood clotting diseases associated with the Johnson & Johnson vaccine. Still exceedingly rare. We've given 14 million doses and they've confirmed 44 cases. So very rare. They have maybe attributed a few deaths to that. So we'll talk about that a little later. There are some other things that can happen: Guillain-Barré syndrome, myocarditis, pericarditis. These are autoimmune things that can happen, your own body attacking itself. We see this with almost every vaccine because we're stirring up the immune system. So how effective are these vaccines? So the 3 ones available in the United States, Johnson & Johnson, about 66% effective. Pfizer and Moderna, this is effectiveness after getting the 2 shots, 95%, 94.1%. So this is like your antibody response. So we draw your blood, we say, okay, you have antibodies to COVID now. This next slide is how effective is it at actually preventing COVID and severe COVID. So it does help prevent you actually from getting COVID. So the darker color here is people who are vaccinated. So how many of them actually test positive for COVID? The lighter is unvaccinated people. So a majority of the cases are unvaccinated. And then how many people require hospitalization? Again, the darker color is people who are vaccinated. So, and then the lighter color is people unvaccinated. So a majority of the people who are unvaccinated end up hospitalized. And then the same thing with deaths. Vaccinated people, very small amount, deaths, large amount are unvaccinated. So one thing I hear quite frequently is, well, this was developed too fast. It came out, COVID kind of hit here in March of 2020, and we came out with a vaccine in January. But actually, as soon as this hit, before we even really cared about it, they were sequencing the RNA. So the scientists were figuring it out before we knew it was going to be a worldwide pandemic. So they had already sequenced it, and we actually had this technology in place. So they had been using the viral vector, which is how the Johnson & Johnson works, and they'd also been using mRNA prior to this. It was basically, we had the technology, we just needed to know what the sequence was of the RNA. This question, can COVID vaccination give you COVID? No, it doesn't have the COVID virus in it at all. What about fertility? They don't think it has any effect on fertility. Millions of people have gotten it. People have gotten pregnant after getting it. They actually recommend it during pregnancy. It can transfer antibodies to the unborn child, both in utero and also through breast milk. Another common question, I've had a COVID infection in the past, should I get it? We don't know for sure. There's been some studies to suggest that probably yes, that natural immunity is not superior to vaccination immunity, and it's more reliable. We know the response. They think the length of immunity after a natural infection is a few months, 2 to 3 months, whereas for immunization, it's more like 6 to 8 months. When should you get it after having an infection? So you can't get it immediately after. You have to be out of your quarantine period, which is usually 2 to 3 weeks. And you have up to 2 to 3 months of probably being protected, but the sooner you get it, the better. Some people say if you get it too close, you might have more effects. So I tell people somewhere between 2 weeks and 2 months after the infection. Boosters, okay, this has been the big thing right now. So we just heard about the Moderna booster, that's been the most recent data. So now for all of them, we have data about and recommendations as far as getting boosters. So we kind of divided into two main groups. Those that are immunocompromised, so their immune system doesn't work like it should. They're recommended to get a booster. They're at high risk for developing severe COVID. So their recommendation is after getting their initial series, they can get a booster after 28 days. So pretty close time frame, but their immune system doesn't work like most of us, so they need that extra boost. For everyone else, the recommendation is a little bit different. So for people who have gotten Pfizer or Moderna, 6 months after your second shot, and it's only for select people. So if you're over 65, if you live in a long-term care facility, if you have underlying medical conditions like heart disease, liver disease, lung disease, stuff like that, if you work in a high-risk setting, so that would be healthcare, teachers, anybody who's exposed to a lot of people. So they intentionally left this a little bit gray. So could you say college students? Probably, because you're around people all the time. So, and then people who live in high-risk settings, so they live in a nursing home or somewhere where they're exposed to a lot of people. They just came out with the Johnson & Johnson recommendation. Remember, back at the beginning, it's only 66% effective, so they're recommending another booster, probably with one of the other vaccines, either Pfizer or Moderna, after 2 months for anyone over 18. So it wouldn't necessarily be the at-risk population. This is some example of occupations that are recommended to have boosters: first responders, education staff, food and agricultural workers, manufacturing, correction officers, postal service, public transit workers, and grocery store workers. All right, that's all my slides. So just full disclosure, so these two have received the vaccine. They did fine. This guy, he's only 9 and he's got weird eyes. And I'm pumping him up to get his, but it's not approved yet. The FDA just said yes, but it's got to go through some other bodies. Hopefully in the next couple weeks it'll be approved. Questions? There's got to be some questions.
So how is it that if someone has a vaccine, can they like be affected by someone who doesn't have it, if you know what I mean? Like, is there any way of them spreading it or catching anything?
You can still get COVID after vaccination, either from another person who's vaccinated or from an unvaccinated person. You're much less likely to get it. And the big thing is you're much less likely to have a severe infection. So I work at the hospital too, and I've taken care of COVID patients in the hospital. Every person that I've had with severe COVID, very sick, requiring ventilator, all that stuff, has been unvaccinated. I've had a few people in the hospital after vaccination with COVID, but it's relatively mild, and usually they're in the hospital for something else. Other questions?
I was gonna say, I don't know if it's necessarily a question. I got vaccinated with the Johnson & Johnson in May.
Yep.
I actually just got out of quarantine a couple weeks ago. I had tested positive. I had no clue where I got it from.
Right.
And then my 7-year-old son tested positive with it.
Right.
My 9-year-old daughter, who's immune compromised, stayed negative
Okay.
the whole time. Can you tell me how that would be possible? Because I'm an only parent with 2 kids at home.
I can't say for sure. I mean,
And I mean, there was contact with her because she can't, I mean, she just turned 9. She can't fend for herself completely,
Yeah.
so.
I mean, unless she had an infection and didn't know it and had natural immunity, or
She
sometimes
was
people just,
tested twice and it came back negative the 2 times.
yeah. You know, especially with little ones, they could have an infection and not know it, so maybe she had one prior or something. I'm not sure.
We thought it was all allergies.
Yeah.
So, because I had her tested and I questioned them and they were like, well, we'll test her again, and it came back negative. And I would have thought she would have been the one that tested positive, not her brother. So.
Yeah.
Like and I'm in the same boat. She just turned 9, so she'll be eligible for it. But now I'm sitting here, do I do it or don't I, with her being immune compromised?
I would recommend doing it. Probably the only option initially will be Pfizer.
She's immune compromised on a medication that makes it even worse, and then she's also on a medication that affects her respiratory system.
Yeah, so yeah, those are all reasons to get it.
So.
And you should probably get a booster.
Yeah.
You said get Johnson & Johnson, so yes.
Yep. So I'll do one of the other ones.
This is not really associated with a college setting, but there's a push to get the younger children vaccinated. Is if they tend not to have severe problems with it, is it a necessary push? I get that they could bring it home to people, but you would hope that adults are vaccinated anyways, and if they're not, that's dumb on their part. They, whatever, I don't care. You can say whatever. But is there a push, why is there a push to get 5 and 6 year olds vaccinated?
So you're correct, they're probably unlikely to get very sick. There are some cases where young ones have gotten sick and have died from COVID, so I'm not gonna minimize that. But if we can reduce the total COVID numbers, then it's less likely to get in our facilities, nursing homes. I mean, that's how it's gotten into our nursing homes, is usually children vector through their parents, and then the parent works at the nursing home. So yeah, to get past this and knock it down to a level where we're not masking all the time and spreading out, that's what we have to do.
In relation to the boosters, so I heard you say if you have the Johnson & Johnson, you should probably get the Pfizer. Is there, no matter what booster you had or what original you had, does it matter? I mean, do you need to stick with the same one, or can it?
So that's a newer recommendation. You can allow for mix and match. So you can get any one after. They do recommend if you got Johnson & Johnson, to probably get one of the other, Pfizer or Moderna. I got Moderna, I'm actually gonna get my 3rd one today. Because I have tomorrow off, just in case. And I haven't decided which one I'm gonna get, but I'll probably get Moderna.
Is it true that Dolly Parton helped to create the Moderna vaccine?
I had heard that she donated a lot of money. I don't think she was in the lab like.
What do you think the future of this is?
I think it's gonna stick around for a while. I don't see it ending next year or the year after. I feel like it's gonna be probably a seasonal thing like the flu, and we just need to be able to knock it down to enough numbers where we don't have to have mitigations. So that's why vaccination is going to be so important, and we're not to that number. We're even close.
Do you think we'll have to get annual vaccinations for it, like we do with the flu?
Probably.
Did they say that getting the flu shot and vaccine or booster, those are, if you get those at the same time, that's okay, or they're not gonna be?
Yeah.
inside?
Yes, that's correct. Initially, they wanted you to wait 2 weeks in between any vaccine, but now you can get them all at the same time. As long as it's not a live virus, which we don't give a lot of live viruses. Like the only one I can think of that we routinely do is the nasal flu shot, but most people, the regular shot.
I was gonna say, my dad just got the flu shot yesterday. He's a postal worker. He just got the flu shot yesterday, and they said he couldn't get the booster yet. He had to wait 2 weeks.
That's the old recommendation.
I was gonna say, this was just yesterday. So,
Was that at a pharmacy or something?
no, the doctor's office.
Okay. Is it here in Kansas?
Yes, actually it was.
We don't need to talk to that office. I mean, that is the thing, like this stuff changes so rapidly. I gave this talk, I don't remember when that was, Melissa, but it was a couple months ago.
Yeah,
And I had to edit a lot of my slides.
Yeah.
So things do change rapidly with this.
Are there any plans for the pediatrician's offices to be able to administer it?
We're working on that. We would like to be able to.
I think a lot of parents would feel safer. Like,
Yeah.
I mean, I took my 13-year-old to CVS to have it done.
Yeah.
But my 10-year-old has a history of anaphylaxis from food allergies, and so she has to stay for 30 minutes, and I would feel like a lot more comfortable having it done in an actual healthcare setting.
Yeah, we're trying to figure that out at Graham. We need to get approval first. We were thinking maybe do kind of like how we do our flu shot clinics, where you know, you book an appointment, but it's nurses and doctors there. It's not the pharmacist, and you can go into a private setting because you know some of these kids will need to get it like in their legs or buttocks. So yeah, we thought about that, and once we get approval, we'll figure out a plan.
Good deal.
So the success rate is based on like percentage of population vaccinated and everything like that, right? So would that then go down or up depending on the number of, as numbers of vaccinated people go up and cases go up?
Yeah, I mean, if we get to a situation where a majority of the population, we're probably at a majority, but if a vast majority is vaccinated, then yeah, those will shift and there'll be more vaccinated people hospitalized percentage-wise, but lower numbers total. Because you know, if more people are vaccinated, then those immunocompromised people will you know, be hospitalized still, regardless of their vaccination status. Does that make sense? So that could shift, but in a good way, because our total numbers will be way down, and it's just those people who don't respond to the vaccine that are sick with it.
Any more questions for Dr. Renick? Everybody tell Dr. Renick thank you for coming out.